Hello friends, I am Dr. Dainik Patel, cancer specialist from Australia, connecting you today to unpack very simple question but yet very complex is how doctor decide what treatment to give to the particular patient. Now I have divided the three main factor into therapeutic triangle. Therapeutic triangle has a three main cornerstone. So the first one is a patient related factor, the second is cancer related factor, and the third one is a treatment related factor. So first we discuss about the patient related factors. So when you see the patients, there are two dimensions to it. One is a physical dimension and one is a mental or emotional dimension. The physical dimension includes patients' age, whether they are healthy at 70 or they are comorbid and dependent on someone at age of 70 or any other age group. The next thing is overall health, whether they have any organ damage, whether they have a chronic heart condition, kidney condition, liver damage, or a bone marrow issues, whether they have any other ongoing clinical problems like autoimmune conditions, whether they have any genetic predisposed, because some of the cancers are hereditary and they carry one particular type of gene which is very important to know as the treatment might be different. The next thing is that mental and emotional factors as well. So that also include their personal values and the goal as well. Some patients have a difficulty in understanding and digest the information. They cannot retain it either due to the memory issue or severe anxiety issues. So it is very important to factor psychosocial and also issue of the dementia into planning the treatment, as if you cannot report the side effect effectively, then it could be a very detrimental to the overall health. Now the next cornerstone is a cancer related factor. It is very important to know what type of cancer we are dealing with, what's the stage of cancer. Until and unless we have this information, you cannot plan treatment ahead. That is why doctor takes some time. So to determine this, the stage and the type of the cancer, you need to have a biopsy, then also need to have a molecular study, and also you need a CT scans or PET scan or any other radiological modality. And so to give you an example, like a breast cancer, most of the time we think that all the breast cancer are the same, but that's not true. There are some rare type of breast cancer you can see in this figure, but also in a common type of breast cancer, there are hormone positive breast cancer, there is a HER2 positive breast cancer, there is a triple negative breast cancer, and also there are some subtype of this based on the aggressiveness and the genetic makeup. And once you have a staging information, whether there is a lymph node involvement, there is a bone involvement or other organ involvement, this all factor encapsulate into the cancer related factor. The third thing comes is a treatment related factor. Now once you have a patient related factor and the cancer factors available to you, that's where you plan your treatment, and so once you have this information, you decide what kind of surgery patient would need, whether patient would need a treatment before surgery or after surgery alone, whether the patient will need a radiotherapy or not. And in terms of the systemic therapy, doctor would assess the risk versus benefit ratio. Many of the time in some cancers we can assess the risk of cancer coming back, or once we know that how aggressive is the cancer, we would have overall survival or a median progression free survival. These are the two complex number I have discussed in other videos, you can see, but that will help you to know how aggressive we should go with the treatment as compared with the side effect of the treatment. To give you the example, the same cancer in a younger population may decide to have a aggressive treatment because they have a more risk appetite and they have a capacity to handle the more of the side effects, while the older patients may decide to have a less aggressive treatment to preserve the quality of life and have a less side effect. And also there is a question comes that if clinical trial is available, depending on the patient's fitness as well, and many of the treatment are restricted for the fit well patients with the organ preservation. So all these factors need to apply when we are deciding about the treatment. To give an example, I recently consulted the patient. She was a 65-year-old lady and presented with the breast lump to the general surgeon, who operated on her because at that time it's deemed to be a non-malignant tumor, but subsequently on the extensive further biopsy, it confirmed that it was a aggressive cancer. Then she underwent further staging and the surgery, and what found out was that there was no any lymph node involvement. The tumor was completely out, and there was no any distant spread either. Now that was the cancer related information, but when the pathologist examined the tumor, it was a triple negative, so it's an aggressive type of breast cancer. And now she was 65, but she has an extensive history of diabetes, and also there was some concern about the kidney involvement. Therefore, instead of deciding to go for a 6 month of treatment, she went on abbreviated treatment for the chemotherapy to modify according to her need and to preserve her quality of life. And then she had a partial mastectomy, so she would also require to undergo radiation as well due to the prevention of the local recurrence. Now you can see that how every component of the information has changed the treatment for this particular patient. So exactly the same way, we should really make sure that we have all the information before we make any judgment and the call for a treatment. Therefore, sometime in current modern era, the multidisciplinary treatment of multidisciplinary care is very important, where we discuss all these factors together and then provide a tailored solution to the patient, and we also call it a personalized treatment. So make sure that you always have option, discuss with your oncologist or your surgeon, and make sure that you get the idea and your therapeutic triangle information before you make that call. Thank you for listening. I hope you like this video. Feel free to comment for any request for any different videos. Thank you.